Hi, I'm Carolyn Zaumeyer, nurse practitioner here at LowTE, Florida, bioidentical hormone practice. When our patients come in, we want to optimize not only their hormones, but their nutrients and their thyroid. When the patients are leaving, they're leaving with some supplements, and they need to know why. Why did they come in to get their hormones fixed and end up with a bag of supplements? Well, it all goes together, and I am so fortunate today to have Dr. DeSilva here to help me explain to you why we take the supplements that we take. Dr. DeSilva.
Thank you but first of all, thank you very much for the invitation. First of all, I love coming to Florida, but more importantly, I love coming to visit you.
Oh.
You know, you've been somebody who's supported us for all of these years, and whenever you call, I'm here. So always know that, and I really appreciate the opportunity to be here with you. You know, supplementation, a lot of people say, well, as you said in your introduction, you know, supplementation, why am I walking out with a bunch of these supplements if I just came in for hormones, if I came in for pellets? Well, here's the way this works, is every single system in the body is connected with every other system in the body, especially when it comes to hormones. You have to optimize B vitamins. You have to make sure that estrogen is going down the right pathway. You need to make sure that your gut is healthy. You've got to make sure your vitamin D levels are good. Iodine becomes critical. So all of these pieces work together. You know, if you have a car, you just can't put gasoline in. You need oil, you need transmission fluid, you need brake fluid to make sure that the car is running optimally, and that's what this is all about.
Right, so we're not only just promoting optimization of hormones, but good health and aging healthier. And why don't we start with DIM? Years ago, you first taught me about this product, and it has been so vital to our practice that I recommend it for every patient on hormones, male and female. Tell us what DIM is, diindolylmethane. Share with us.
Right. DIM stands for diindolylmethane, as you said. It's used in men and in women. Let's start with the ladies. Well, when you put estrogen in a woman, when you use estrogen as a pellet or in any form at all, we want to make sure that estrogen gets pushed down the right pathway. And that is exactly what DIM does. DIM takes estrogen and says, okay, you need to go this way instead of going this way. Because if you go this way, it's going to protect your breast tissue, it's going to protect your uterus, it's going to protect your ovaries, it's going to protect your cervix, and what it's going to do for you is that it's going to raise your free testosterone just a little bit. So that's always a good thing because I'm also giving you testosterone. In men, what it does, it is called an aromatase inhibitor. It prevents the conversion of testosterone to estrogen. We don't want your testosterone that you're giving and that I'm giving patients to be converted to estrogen. Because what's going to happen is if a man starts converting testosterone to estrogen, when he watches those movies, he's going to start crying. So I don't want you crying while you're watching certain movies. I also, and here's how I get men to take the DIM. What I say to them, and please excuse me for saying it this way, but what I say to them is, do you want to have breasts? No, you don't want to have breasts if you're a man. And that's what this does, is that it will prevent the conversion of testosterone to estrogen. And if you don't take this, that's going to become a problem. So making sure that you prevent that aromatization or conversion is extremely important.
Right, because the aromatization can lead to more belly fat, feeling sluggish, and prostate issues down the road if they're not monitored. So,
and that's exactly what I was just going to say next. This is not only good for aromatase, prevent that conversion, but it's also protective for the prostate. It will also raise the free testosterone a little bit. So there's various applications here, and it becomes anybody that's using hormones. This is a must.
And when he says raising the free testosterone, he's basically saying that the testosterone that you have inside can be bound to a protein, and this will help release that so you feel more of the effects of the testosterone and also get the physical benefits of the higher testosterone. So, yeah.
Absolutely. And as you can see, this young lady has been listening for a lot of years and knows a lot at this point. So, and I love to hear you say things like that. So true.
Our next go-to is vitamin D, because over 90% of the patients I see are deficient. Even though we're here in the sun, loving the beach and the boat and the beach, you know, all the good things in the sun, most people, over 90%, are low on their vitamin D, and that's critical to get that up. So why don't you share with us? We've got the 80K, which is 5,000 IUs, and the 80K10, which is usually our starting, depending on their lab values.
Right, and it is, and what this is as you said, this is 5,000 units, this is 10,000 units, and it's a combination of vitamin A, vitamin D, and vitamin K2. A lot of people will go to the stores, and a lot of products today have a combination of vitamin D and vitamin K2, but they're in the wrong proportion. They're in that, or they don't work together, and synergistically we have the A in there too, because they all work together. Vitamin A is the transport. It helps get the vitamin D into the body. And vitamin K directs the vitamin D and the calcium where to go. So it's a gatekeeper. We've got a carrier, which is the vitamin A, and then we've got a gatekeeper, which is the vitamin K. So they have to work together. And they must work together, and this combination is extremely important.
I have patients that when I do their initial labs, it'll come back low, but they're like, why? I'm taking vitamin D. I've been taking it religiously for 3 years, and it'll be below the normal. And I'll say, where are you getting that? And they'll say the drugstore, the grocery store, the big box store, and I'm like, that's the problem. Take whatever you're taking and give it to somebody you don't like, because it is not doing you any favors.
That's one of my lines.
It is not doing you any favors at all. So get rid of it. Start taking this. Let the A help it absorb. Get the synergistic of the D and the K to build your bones and your teeth, your mood. It really has some really good, and it also helps with your immune system, correct?
Absolutely. Absolutely, and that's so important. You know, during these times, there are so many people that need immune support. And vitamin D is critical for that. It is absolutely critical. And by the way, you mentioned something that I want to reinforce here. What you said was about the bones and the teeth and things like that. Vitamin K is very important because it activates a certain protein that rebuilds the matrix or the inside of the bone. Vitamin K also prevents the deposition of calcium in the wrong places in the blood vessel. So vitamin K is just, I can't stress the importance of it with this combination. And vitamin D, yes, it's called the sunshine vitamin. Vitamin D also is great for the brain because people that have seasonal affective disorder, what do they have? They have a vitamin D deficiency. It is incredibly important for the immune system and is extremely important for the cardiovascular system. So it's not just, oh, my vitamin D level's low. No, it's a systemic thing that we need to have to make sure you support all the systems of the body.
So your body's functioning the way it should, so you feel better and you age better.
Absolutely,
Yeah,
absolutely.
Well, the next one, we both get very excited about this one. We both are very passionate about the LowTE probiotic.
Probiotics. You talk about immune system, there's nothing more important. This is my #1 recommendation for better health. If you want better health, you have got to have a good immune system. There are 4 things that the probiotics or the good bacteria do. #1, immune system. 70% of your immune system resides in your intestine. #2, digestion. It is important, it is critical that your food gets digested. #3 is elimination. You have to eliminate the food. And #4, the good bacteria make most, if not all, of the B vitamins. And we're going to be talking about the B vitamins in just a little bit. You have to have the right B vitamins in order to make your hormones. If you don't have those B vitamins, you cannot make estrogen.
Right.
Or you'll be deficient in making the right amounts of estrogen. So the right flora, the right delivery system, the right technology is what this is all about.
So this has a patented capsule.
Yes.
that opens in the beginning of the small intestine. So then it has all that time for the 3 most studied microbiota to repopulate and make your gut healthy. And when it does that, that helps you absorb all your good nutrients that you're bringing in through your diet, your supplements, and your hormones, helps them absorb better to have a healthy gut.
Absolutely. And the delivery system is something that I've worked on delivery systems for the past 35 years that I've been in clinical medicine. So the way we developed this is I wanted to make sure that this got into the body, just like the vitamin D, right? Just like the vitamin D, it's a combination of A, D, and K2. The probiotic, it's a capsule technology, as you mentioned. It's an acid-stable capsule that opens up in the beginning part of the small intestine, and as a result, you're going to have greater bioavailability. So people say to me, well, why did you only put 3 strains in there? The reason I only put 3 strains in there is Lactobacillus acidophilus, Lactobacillus rhamnosus, and something called Bifidobacter bacterium. Those are, as you said, the 3 most studied organisms. Those organisms have the broadest application throughout the body. So it's not just skin, it's not just gut, it's not just any other part of the body. It's a broader application that hits everywhere. And it's absolutely one of my best, and it's our flagship product that has been our product for many, many years.
Yeah, and I like what you said, that what we have here, the combination of all of these are very well studied, high quality supplements that are handled properly, kept cool, just treated properly, so you're getting your best bang for your buck.
Absolutely.
The next one I'd like to move on to is the methyl factors, and I promote this as an energy vitamin. I see the B vitamins low in a lot of my patients, and I take it myself 1 to 3 times a day. After lunch, if I need a little boost, I'll take one. Share with us more about the methylation factor and why this is important to our body.
Absolutely. About 60% of the U.S. population cannot convert certain B vitamins. They have what is called an MTHFR break. It's a genetic defect that people have that they can't convert regular B vitamins. So if you go to the store and you buy a B complex, you're likely going to get something called cyanocobalamin, which is the wrong form of B vitamins, because your body now has to convert that to the methylated form in order to utilize it. Why am I giving your body more work to do? It's, again, I'm coming back to vitamin D. Give your body vitamin D3, not D2, in a form that it knows what to do with. And it's the same thing here. Give your body what it needs so that it doesn't need to do more work. Because if you have to go through more steps, your body's going to now use and need more energy.
Gotcha.
You don't want to utilize too much energy on a cellular level. You want to utilize the energy that your body needs to do what it needs to do. So this is a methylated form of the B vitamin that your body has and needs, that it doesn't need to do more work. If you have that break, and again, 60% of the population have that, you can do a test to test that. But why go through it if you don't need to? Yeah. Just take the right form and your body will do what it needs.
Absolutely.
And by the way, you need this for your hormones. I said this before. If you don't have B vitamins, you cannot make estrogen. It is part of the process. It's part of that biochemical process. B vitamins are important for your brain. B vitamins are important for your heart. B vitamins are important for hormones. B vitamins are important for energy. So instead of that cup of coffee in the afternoon, take a B vitamin, and that'll get you going.
And most of my patients, especially on the first visit when they come in, fatigue is the #1 reason why they come in. You'd think, oh, it's ED or sexual stuff, but no, it's fatigue. People are tired of being tired. And what I like to do is to introduce this in the beginning, because while their hormones are kicking in during that first 4 to 6 weeks as the hormones are building up, this can give them that energy and that feel good while they're building up to get them to the happy place. So that's why I really appreciate this product.
Absolutely.
The next one, you talk about everything adding on to each other. It's like this iodine, we're talking about LowTE Iodine Plus. You have to have iodine to build thyroid, and thyroid is almost everybody. I'm correcting a lot of thyroid, so I usually pair it with this. Share with us more about the Iodine Plus.
Well, iodine, first of all, is another one of the nutrients, along with with DIM that we need to have to make sure that estrogen does what it's supposed to do. This combination is extremely important to direct estrogen down the right pathway to protect, as I said before, breast tissue, uterus, ovaries, cervix, etc. This combination is, I can't tell you how important. Iodine, when you say iodine, the first thing you think about is the thyroid. Yes, a lot of iodine gets directed into the thyroid tissue because iodine converts T4 to T3. T3 is the active form of thyroid. Making sure that that conversion happens is a big part of it, has to do with iodine. Now, why are we even talking about iodine? The reason we're talking about iodine is because so many people are deficient in iodine. Why? Because iodine was taken out of bread, it was taken out of the pasta, and bromide was introduced. And bromide is what is called a halide. When you use bromide in the bread, in the pasta, displaces iodine from the body. The way, and I'm afraid to even begin to say this, and I'm trying to think of saying this in a way that is appropriate. Women that have problem with cysts in their breasts, in their ovaries, in their uterus, the studies go back to Canada. The Canadian data on this is those women have huge deficiencies of iodine. Mm-hmm. So that's one of the things that I do with women is I'll always check with your physician, but this is a very big piece of this,
yes.
And it's very important.
I used that before I was even really into hormones with my gynecology practice. For the women with a fibrocystic breast, I would encourage them to get a good iodide complex, with the right balance, because that's critical. Some people say they use drops.
Right. Well, I mean, it's up to you, right?
Mm-hmm.
I mean, it's up to you. Some people use some of the drop solutions. Mm-hmm. Here's the problem with that. And I did this for a while personally, but the problem with that is that it starts to stain your teeth.
Ugh.
So anytime you think about this, right?
Yeah.
You put iodine into a porous situation like your teeth, it's going to absorb that. Mm-hmm. And at one point, my teeth were starting to yellow, and I'm thinking, what's going on here? Because the dentist said something to me. I said, holy smoke, I think it's the iodine. Yeah. And I stopped it right away. There's no matter how you dilute it, you're going to get some staining. So I like the oral form much better.
And they're tiny little capsules.
Yes,
Very easy to take. I love those.
They're easy to swallow.
Yeah.
No issues with it at all.
Well, our final product to go over today is the Free TE, one of my favorites, LowTE, Free TE. We had spoken earlier about the sex hormone binding globulin, which is a protein that can be produced from your liver that can attach to your hormone molecules. And when it does that, you don't feel the good effects that you're shooting for with your hormone therapy. So what this does, when you bring it into the body, it breaks that bind. And so then you have more bioavailable, free-floating hormones. So you feel the effects of it and you get the physical benefits of having your hormones optimized. So Free TE, most of my patients, I have them take 2 in the morning just as a regular supplement. And I take it myself just so that I want to get everything out of my hormone optimization. I want to get the most. I just want more.
Absolutely.
And so I take 2 in the morning, and then you can take 2 before, an hour or so before exercise or intimacy, and it frees up that testosterone so you can have a better workout and better relations. So it's all natural from a tree in Malaysia. It's actually made from a root. Mm-hmm. The men there have been using it for years, an elixir that improved their virility. They were getting more cut, muscular when they were working out. Their workouts were better. And they just felt more manly. I don't want to feel more manly, but I want the effects of my testosterone as well.
But again, for women.
Absolutely.
This is one of the supplements that have been proven. And this was a venture that was done between MIT and the Malaysian government, right? And they came up with this LJ100, which is the active ingredient in here. This is something that I did a lecture on probably 10 years ago. And this was at the top of my list when it came to men and when it came to ED, virility, exercise, and just overall feeling better. And you're absolutely right. Yeah. The way this works is that it frees the testosterone, because everybody looks at total testosterone. It's like looking at thyroid. You have to look at the free component that is out there doing the work it needs to do. You don't want to look at the bound fraction, because if it's bound to a protein, it's not doing anything. You want to unbind it so that it becomes free and it attaches and does and goes to the cells of the body that it needs to do. And that's exactly what this does.
Yeah.
It isn't just, again, it is not just about erectile problems. It's also about energy. It's about cellular health. It's all of those components together, because this has an antioxidant effect also. So not only is it working to unbind the testosterone that's bound, it's an antioxidant, and it's a very potent antioxidant when it comes and it has to do with aging. So a big piece of this has to do with that.
This has been really great for my practice for patients where I optimize their hormones. Their total testosterone looks fabulous on paper, so you know they have plenty of hormones on board, but they're just not feeling the love. They don't feel the good effects that we were shooting for, that I overpromised to them.
Right.
The energy, the sleep, the mood, the whole bit. And this can make all the difference in the world. And we're actually selling it throughout the country. It's just going like wildfire. So it's a very, very good product. But anyway, I think that wraps up all of our products here that we were highlighting today. And I thank you very much for all your support. I mean, you basically introduced me to all of these years ago, and I've just really learned the value of them, and combining it with our hormone optimization, our thyroid optimization, good nutrition, no more ho-hos, ding-dongs, and all that good stuff. This is one of his old talks.
Right.
And staying away from the Diet Coke.
Right.
But thank you so much for coming out. It's always a pleasure to see you, and I always learn new little nuggets, whenever I'm with you. So thank you very much.
Well, I really appreciate it too. And, I tell people this all the time. It isn't just one thing, right? We need to make sure health is a combination of things. It's optimizing your hormones. It's making sure you're having the right nutrients. It's making sure that you're moving. It's making sure that you are taking these supplements. And again, very importantly, being a good person. I think that
There you go.
that little piece of doing that one good deed a day, if you will, to really boost your immune system even a little bit more, why not? So do the good things in life, and it will come right back to you.
Absolutely. Thank you.
You're very welcome. Thank you.